Foot pronation, also known as flat feet, is a common issue for many people. It can cause pain in the hips, the lower back, the knees, the ankles, and obviously your feet. It causes your feet to roll inwards and create tibial torsion where your knees bow in, and that can cause stress and strain in your hips and lower back as well. It shifts your weight into other structures such as ligaments, joints, and muscles have to compensate, and that can cause pain and also promote arthritis or degenerative change. A lot of people self-diagnose themselves for plantar fasciitis, which is an irritation of the connective tissue under their foot. And I'm going to show you in this video some short-term things you can do to prevent this pain or improve this pain. I hope these exercises and stretches help you as much as they helped me and my patients.
Calf raises with a ball. Sit on a bench or a chair that will allow you to have your knees bent at approximately 90 degrees and pinch a tennis ball with both heels. This creates slight foot eversion, meaning it rolls your ankles outwards and your heels inwards. Then push the balls of your feet into the ground to lift the heels up, contracting and squeezing the calf muscles like a calf raise. Try and visualize squeezing and creating an arch under your foot at the same time. Do this for 15 to 20 repetitions, 3 to 4 sets. Avoid having the tennis ball fall towards the ground throughout the whole exercise. This will help lengthen and strengthen the muscles in the feet and the calves to help support the feet and reduce foot pain and leg pain. By squeezing the ball between the feet, it will help promote you squeezing the muscles that create an arch in the foot. Like other natural curves in the body, like the spine, arches are very important to support our body weight. A paper was published in the Journal of Sports Rehabilitation in 2019 October on the research of intrinsic foot exercises and how it affected the navicular drop in the foot and foot pain, aka the drop of the foot arch. After 6 weeks of the exercises, patients reported back with the reduction of pain and the decrease of foot pronation and navicular drop, meaning the reduction of flat feet. So if you're suffering from foot pain, plantar fasciitis, or flat feet, please try out the exercises in this video. Weighted dorsiflexion. Start by sitting on a small stool with a weightlifting plate rested on your knees. Drive your knees forward as possible and pass your toes, without your heels coming off the ground. Do this by leaning forward and pressing gently on top of the weightlifting plate. Try to shift slightly and slowly side to side and explore which areas you need to work on more. This is a mobilization type stretch for the calf muscles and to increase dorsiflexion in the ankle. Hold this position for about 30 seconds or 10 deep long breaths. Have a break for about 30 seconds and then repeat the exercise again 4 to 5 times. Once you are comfortable and confident of not losing your balance, try to do the stretch on each leg without the stool and lean a majority of your weight over one leg. This will force you to go more deeper into a stretch with an increase of range of motion for ankle mobility. The same weightlifting plate is now technically 2 times heavier on the ankle joint since the weight is only acting on one leg and not 2. If you don't have a weightlifting plate, you can always be creative and use something heavy to press down on top of your knees. Here, I'm using a large bag of rice. You can use a large bag of potatoes if you like. In this technique, try to be relaxed as possible and feel the body weight pressing evenly on the ball of your feet and the heel. At no point should you feel your heel lift off the floor. If it does lift off the floor and you feel most of your body weight on the ball of your feet and your toes, the exercise is no longer working to improve ankle dorsiflexion or stretching your calf muscles. I know I mentioned to lean your knees past your toes, and a common misunderstanding that it is dangerous to do so. I used to think this myself. There are even old, outdated textbooks out there saying that you should not squat having your knees past your toes. But if you do further reading and research, doing this will allow you to utilize the natural full ranges of motion of your ankles and your knees, which many athletes such as martial artists, Olympic weightlifters, and gymnasts benefit from. This ability to move and be strong in this range of motion will not only allow you to move better, stronger, but also prevent injuries such as lower back injuries. Foot self-release. Sit on a chair and place a lacrosse ball or massage ball on the ground. Position the sole of your foot on the ball and gently roll your foot over the ball. Spend more time around the tender areas. Roll the lacrosse ball up and down from the heel to the ball of your foot, allowing the structures of your feet to relax and almost wrap around the ball. Roll up and down under your foot for 20 strokes on each tender area and move on to the next. Make sure you return to the tender area again 4 to 6 times and repeat the process. Once you are ready to add more pressure on the feet, you can stand up and add more body weight onto the bottom of your feet, but please be careful. Even for me, this is quite painful to do. This will passively move the joints of the feet whilst massaging and stripping the muscles in the feet. This can help release tight muscles, reducing spasming in the feet and the legs, therefore reducing pain and tenderness in other areas such as the leg. I'll put a link in the description box below on where to get this massage ball.
Once again, guys, thanks for watching. I really want you to join my VIP Facebook group. I want to build a community there where we can discuss all things health, and there'll be other health professionals in that group as well to help you out. Now, if you want to ask me a few questions and you can't wait for my answer and you want to support this channel, please join my Patreon. That way you will support me, support this channel, support this service to help everyone around the world. We want to keep this going as long as possible. I'll put the links in the description box below. Now, if you do have lower back pain, and there could be a chance that you're getting it from flat feet or even bowed legs, and it's stopping you from getting out of bed or doing daily tasks, please check out my 3 exercises for acute lower back pain. That video will definitely help you get moving again and also prevent lower back pain. I still do those exercises on the daily. Now, if you do have flat feet, there could be a chance that you do have bowed legs, knock knees, where your knees move inwards, and you might want to do some exercises to prevent that or improve that so you don't get degenerative change and promote flat feet. Please check out my bowed leg video. That video will definitely help you out. Now remember, support this channel, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.